Hi, I am Andrea Wong-Sam, a proud volunteer for and supporter of the American Heart Association. As a heart attack survivor myself, I am so excited to sit down with you and talk about the critical importance of women's cardiovascular health. The Red Chair Series conversations seek to inspire and inform women to be strong advocates for their health and well-being. I am talking to Dr. Sabra Lewsey, a cardiologist with Johns Hopkins Medicine. Dr. Lewsey, please tell us about yourself and your practice.
Sure, it'd be my pleasure. Thank you so much for having me here today. I am a heart failure cardiologist, and what that means is that I specialize in taking care of people across the lifespan, as young as 18 years old all the way up into their 90s, who have issues with the effectiveness of their heart pumping function. My job as their advocate, as their provider, is to diagnose and figure out what's led to the heart failure to begin with, make sure they're on the right therapies and have been considered for all the therapies that we have to bear and that are available in our armamentarium, and then to think down the road about how do I ensure wellness for this patient in the long term with heart failure, and that might include thinking about things like heart transplantation or mechanical heart pumps.
What are some of the key things that women need to know about cardiovascular health?
So the thing about cardiovascular disease is it's the #1 killer of women, and a lot of women don't even know that they're at risk. Some 40% of women actually have clinical cardiovascular disease if we include hypertension. Ensuring that there is awareness, ensuring that women know what numbers to be informed about. We say know your numbers, and one guide to that is following the AHA's Life's Essential 8s. That's really helpful in preventing down-term implications in terms of preventing cardiovascular disease. And then for women who may have cardiovascular disease, ensuring that their cardiovascular disease is as slow as possible or does not progress.
So pertaining to heart failure and heart attacks,
Yes.
what is the difference?
So it's an important distinction. So heart attacks can cause heart failure. A heart attack is essentially an interruption to that blood flow, and that heart muscle gets starved. And if the heart muscle is starved, it isn't able to function the way that we would want it to function. When we think about heart failure, a lot of times you'll hear something about an ejection fraction. That's the way that we look at the left pumping chamber and how efficient it is at getting blood flow out. That's one form of heart failure with reduced ejection fraction. There's another form of heart failure that also impacts women, which is heart failure with preserved ejection fraction, where the ejection fraction can actually be in the normal range, but the heart is still ineffective at relaxing and getting blood forward to do the work that it needs to do. So it's important for women to know that their symptoms, they may have chest pain, they may not have chest pain, they may have shortness of breath that's associated, they may not. They may have a feeling of sweating or uneasiness or just this sense of impending doom. Heart failure, the classic symptoms that we talk about are swelling in the legs, maybe some belly bloating or belly distension from fluid getting in the belly, shortness of breath with activity. But it's important to know that heart failure exists across a spectrum. And there are people who are able to do their daily activities and have no symptoms of heart failure, but we know that structurally the heart pump function is not in the normal range.
Thank you so much for that. At the American Heart Association, we talk a lot about women being their own advocates. What does that mean to you?
So on the individual level, I think about knowing your numbers, knowing your condition, knowing your ideal health, what you're working towards, advocating for yourself, going into your appointment with the information, and really ask your doctor to be candid with you and have that exchange about preserving your heart and brain health. If you feel as though something is not right, you make sure you are heard.
Thank you so much for sharing with us.
It's my pleasure.
The American Heart Association has many tools and resources online at www.goredforwomen.org. Huge thank you to you, Dr. Lewsey, and to Johns Hopkins Medicine for supporting this Red Chair series.